My name is Daniel Merrill. I'm currently a captain and I am a 62 Alpha, an emergency medicine physician. So an emergency medicine physician can fill a variety of roles to include a battalion surgeon, a flight surgeon, or an inherent emergency medicine physician role. I currently work in the hospital here at Fort Carson, Colorado, and then I also work with the 64th Brigade Support Battalion as far as emergency medicine training, readiness, trauma training, and then of course working with our medics, which is what we're doing today. We are using the TC3X, which is a high-fidelity simulation that actively bleeds and responds to these treatments. And so we were doing trauma lanes to give them the ability to practice these scenarios on a high-fidelity mannequin. I coordinate and supervise all training. The medics will be operating either under my license or the battalion surgeon license in a deployed setting. So we are currently co-locating with an FRSD, which is a surgical team that is able to deploy both rapidly and to more forward locations. Each task varies. The goal for these trauma lanes is to have a realistic trauma scenario. So ideally we're doing an initial resuscitation in about 10 minutes, but it'll vary on patient complexity. For a successful trauma lane, what I would hope is that they have rapid stop of hemorrhage and massive life threats, to take an assessment of the airway, respirations, and then circulation as well. We're trying to push that to the next step by looking at where will this patient go next, if they're going to need surgical capabilities or blood transfusion, what medications will increase survivability for these patients. We currently have 3 physicians or physician assistants who are attached to us. The way that we break up typically along a table is we'll have one person who's in charge of the airway or the head of the bed. We have one person to the patient's right and one person to the patient's left. The 4th person can either act as a scribe with medications or as a floater to assist. With this patient specifically, since they had 2 massive hemorrhages, we had the person on the right controlling the lower extremity amputation. Since that takes 3 minutes, sometimes having that extra set of hands can really help. So one of the most beneficial parts of this training is being able to do these scenarios with our own equipment. This is what we have within our own sets. It's what we're going to deploy with. And being familiar and actually getting those hands-on and using and having those reps for that muscle memory is incredibly beneficial when your adrenaline is up and it's a friend or a loved one on the line.